Hi, I'm Dr. KP, and today's video is going to be on which doctor should I see for my joint pains. Joint pains are incredibly common. In fact, pretty much all of us will experience joint pains of some description at some points in our life. But if your joint pains have been persistent or are getting worse, or there are other features to the joint pains that don't seem right, like redness or swelling or stiffness, then it might be time to go and get this checked out by a doctor. But which specialist should I choose? In this video, I'm going to talk mainly about the medical specialties. There are, of course, other healthcare professionals that might be helpful: chiropractors, osteopaths, and physiotherapists. But when it comes to the medical side of things, there are four main specialists who deal with joint problems and musculoskeletal issues. So the first one you might want to consider would be a general practitioner, or they might be referred to as a family medicine consultant. These doctors are incredibly broad in their knowledge, and they understand a great deal of medical and surgical issues. In many instances, if it's a simple case of joint pain that's quite common, they may well be able to enact a proper treatment plan for you, refer you to specialists like physiotherapists or occupational therapists, and prescribe medicines in the short term that might help. They also will be able to refer to the right specialty doctor if they think this is something that needs more long-term input. So who else could look after your joint pains? Sports and exercise medicine doctors are another area that's worth considering. Now, sometimes we call these doctors movement medicine or musculoskeletal medicine doctors, because you don't really have to be a high-performance athlete to benefit from seeing a sports and exercise medicine doctor. If you're finding that the pains in the joints or around the soft tissues of the skeleton and muscles are things that get particularly troublesome when you're moving, when you're doing sport, when you're doing exercise, it may be that a sports and exercise medicine doctor is the best person to approach to support you in how to manage those symptoms. So what about a rheumatologist? When do you see the rheumatologist as the best person to be seeing first? Well, the expertise of a rheumatologist is particularly in inflammatory conditions. So if you have any of the following symptoms, you probably should see a rheumatologist first. This would include swelling in the joints, heat in the joints, morning stiffness, and any redness. If you have a family history of inflammatory problems in your family, things like rheumatoid arthritis, lupus, psoriatic arthritis, or gout, then again, a rheumatologist is probably the best person to see first. Rheumatologists are also expert in being able to pick out inflammatory from non-inflammatory diseases. So even if it turns out not to be something that's an autoimmune or inflammatory complaint, a rheumatologist will know how best to serve you and forward the referral, if needs be, to one of the other areas. So finally then, orthopedic surgeons. Orthopedic surgeons are, as the name suggests, surgeons, so their expertise is in the practical side of supporting patients. This could be in joint injections, looking inside of the joint with a camera, which we call an arthroscopy, remodeling of the joint, or replacing the joint. If your symptoms are focused on one joint area, such as severe knee pain or severe hip pain, you may be best served by seeing an orthopedic surgeon who can offer expertise in some practical approaches for that particular joint pain. Also, if you know what your diagnosis is, for example, you know that you suffer from osteoarthritis and it's becoming hard to manage, then an orthopedic surgeon is the only person that can offer the procedures like a joint replacement that can help. If you're not sure, probably the best bet would go to see a family medicine doctor or a general practitioner, because they will be able to determine which is the best appropriate step for you to help find out why you're getting the joint pains and, crucially, what we can do to help support you with those symptoms.